Hi everyone, this is Dr. Boone. I work at the McKinney Kidsville office. Let's talk about umbilical cord care. So one of the most common questions that I see at office is, when is the cord going to fall off? And it's a great question because it can really vary. Sometimes it falls off within the first few days. Other times it can take up to 3 weeks. If it's going past that 3-week mark, I would come in and see us just so we can make sure everything looks okay. Another question I hear is there supposed to be a smell, or why is there some discharge coming out? And while this is usually completely normal, I would still bring baby in just so we can make sure there's no signs of infection going on. Something I also see quite frequently is something called an umbilical granuloma. What this is a part of a pink scar tissue that forms when it's not healing correctly. And sometimes this can be the cause for the discharge or the odor that you might smell. There is a good treatment for it. It's very easy to treat in office. It's used with something called silver nitrate. It's just at the end of a Q-tip, and what we use is we put it on the scar tissue and it cauterizes the area. It therefore affects the blood flow so that that scar tissue will stop forming and it will stop leaking and stop smelling. And this is a very painless procedure, so don't be worried about your baby experiencing any pain. And sometimes it might take more than one treatment, sometimes 2 to 3. So don't be afraid to come in and have that procedure done for your baby. If you have any other questions about umbilical cord care, we would be happy to talk with you. Just schedule an appointment or give us a phone call, and thank you for listening.